Okay, class, I'm in my Articulations 2 PowerPoint. The one I had before I was going through was the Articulations 1. All right, let's just kind of talk about a few things. This is the classification of synovial joints based on the shape of the articulating or the articular surfaces. In other words, what is the congruence of shape between the two bones? Let's start first with the plane. Okay, this is a plane joint. It's more of a sliding action. You can see in those joints right here, which would be what? Your carpal bones. All right, let's go further. This is the hinge joint, which you can see right here. That's that hinge joint right there. That's the olecranon. Remember we had right there, that's that elbow. Okay. Right here is the pivot joint. You can see, based on the shape. It's kind of like thinking about a hinge of a door. Condyloid shape. Saddle shape. Ball and socket. The ball and socket is the one that gives you the most mobility in all kind of directions. Multi-plane. Because when you're looking at that, let's just go to this real quick. When you're looking at that, not the one I want, right here, you are looking at the amount of mobility. See, non-axial slipping movements on, uniaxial movement in one plane, biaxial. See, this is multi-axial right there. See right there? And see, non-axial, let me go up here, would be more this here. Slipping movements only. See, slipping movements, just sliding. Uniaxial is really in one plane. So you can only go in that one plane right there, the way this is. Okay. Biaxial, you could slip around here in a couple of planes. See, 1, 2. But the only one that gives you all that mobility is what? That ball and socket, which would be here and also at your hip. See, at your shoulder and your hip. Okay. So let's go further. So then we talked about this. So where we are now is here looking at this knee. Now I want you, when you look at that knee, you see a lot of different ligaments and so forth like that in that knee. Here's that anterior cruciate. Let me go down here and see if I can find something. So the largest, most complex joint of the body. 3 joints surrounded by 6. Okay. And so right here, you see you have bursa, we talked about. Now I wanted, something we hadn't talked about was the meniscus. The meniscus is like a pad. It's like a pad that helps those articulating bones fit more congruent. See right here, this meniscus. You've heard of meniscal tears perhaps. Here's that cruciate ligament. Okay. Here's that knee again. See, that's that quadriceps. That's that medialis of the quadriceps right there coming down. Patella tendon right there. Patella tendon right there. Patella ligament, shall I say, right there. And then you have a patella tendon too. Okay, so what happens is, like right here, here's this hockey puck. You see it's tearing that meniscus a little bit, that collateral ligament, and the anterior cruciate. Now I'm making this particular video here on the 13th of November 2017, and this is the time when the quarterback for the Texans got injured about a week ago. And see right there. So what they do is, to be able to do a more non-invasive, I'll show you this, you go in with this arthroscope. See, this arthroscope can go in, it's a fiber optic, and you can look, and this is how they do that arthroscopic surgery there. Just showing you how that works. And that gives a minimal amount of downtime, but you still got to heal. You still got to heal. Now, if it's a professional athlete, it's going to take longer. Not because, I mean, they're in good shape, but it has to be perfect. Now, if you just a couch potato, you know, you're not using it much. Or if you're just a novel athlete, you know, just every now and then on weekend, do a little something, then that's different. Okay. Here's that shoulder joint right there with its various aspects there you can glance at. There's the elbow right there. See, that's that bursa. Heard of bursitis, tennis elbow? Right there. All right. So what we're doing, I'm just showing you a few things. I'm going to come here. Again, some of this is beyond what we need. Here's looking at a meniscal tear through the arthroscope. Here's rheumatoid arthritis, with synovitis of the affected joint. Rheumatoid osteoarthritis primarily affects the hyaline cartilage. Rheumatoid arthritis is really more of an autoimmune. Inflammatory migrate to the point, and then it starts invading the joint. So it really involves the synovial membrane first, and you get this look here. Chronic autoimmune disease of unknown, usually arises between 40 and 50, but may occur at any age. 3 times more common in women than men. Joint pain, swelling, osteoporosis, which means, you know, some bone loss, muscle weakness, and in some cases cardiovascular. Cardiovascular in the sense, I don't know if you've heard of rheumatic heart disease. Rheumatic heart disease. We'll talk about rheumatic heart disease in A&P2 if you take me. All right. So I'm going to close the articulations here. I'm not going to get into Lyme disease. That's treatment there, conservative. I'll mention that Lyme. This is gouty arthritis. Gout is where you have too many uric acid crystals. Uric acid is the breakdown of your nitrogenous bases in the joints, followed by inflammation. Many things can do it, more common in men. Even some medications like hydrochlorothiazide for blood pressure can do it. Okay? If untreated, the bone ends fuse and immobilize the joint. That's what we call ankylosis. Ankylosis is when joints fuse. Lyme disease transmitted by ticks may lead to joint pain and arthritis. Antibiotics. Okay, we won't get into that. All right, so we'll close here. And this is kind of your little brief discussion of joints, articulations.